And joining us in the studio for more discussion on the 2017 World AIDS Day is the Director General of the National Agency for the Control of AIDS, Dr. Sani Aliyu. You're welcome to NTA Network News.
Thank you for having me.
It is another World AIDS Day. As a country, do we say we are on track in dealing with this pandemic?
Well, I would say we are on track, but we still have a lot of work to do. As shown in the earlier presentation, we've just crossed the 1 million person on life-saving treatment. That's a huge achievement. If you look at 10 years ago, we had only 138,000 Nigerians on treatment. But this is just the beginning. We still have another 2 million to go, and it's going to be a huge challenge. But it's a challenge that we look forward to addressing. Government has realized that the most effective way of getting on top of the epidemic, what we call epidemic control, is to put those with HIV, to identify them and to get them on treatment as soon as possible.
What of mother-to-child transmission? Any reduction?
So mother-to-child transmission, the issue is a lot more complex than in the general population. One of the problems we have is the mothers themselves are not presenting for testing. So in 2017, the first 6 months of 2017, we diagnosed 32,000 pregnant women with HIV, and we linked 27,000 of them on treatment, which shows that if we're able to get them, most times we're able to link them to treatment and keep them on treatment. But the problem is more than half of the pregnant women that should have been tested in 2017 were not. They didn't present. And maybe it's a reflection of how our mothers address antenatal issues. A lot of them don't go to the usual formal setting like facilities to get antenatal care. They use traditional birth attendants. Sometimes they use churches, places of worship, etc. So those are the ones that we need to concentrate on.
Apart from creating awareness through the media and other mediums, what other measure is the government taking to curb the spread?
So awareness is obviously the most important part of it, what we call demand creation. And demand creation goes beyond just the traditional media. As you know, young women, particularly between the ages of 15 to 24, form the bulk of all new infections. Most of the new infections occurring in Nigeria occur in that age group. So, and with that age group, what they use is mostly social media nowadays. They don't sit down to listen to radio. They probably watch your news, but they don't regularly sit down to watch TV. So we're doing a lot of publicity through the social media side. We also have what we call youth-friendly centers in a lot of the tertiary institutions where we provide health services, including HIV testing, and we also provide a space, what we call a safe space, for them to go enjoy themselves and at the same time get a HIV test done.
How would you react to claims of out-of-stock ARVs while the global fund commodities are lying at the ports and at the verge of expiration? So
we're working very closely with the Federal Ministry of Finance. Just last week I was at the ministry to see the Honorable Minister. We know there have been issues in the past with relation to commodities, but remember, Nigeria is a big country. It's a big country with a very heterogeneous epidemic. And logistics have always been one of the weak points of the entire response. And we're working very hard to sort this out. Just recently, the Honorable Minister of Health launched what we call a warehouse in a box, where we're able to get commodities and put them in a warehouse that has mobile facilities that will be able to deliver those commodities to the facilities. But it's not a small job, and we are certainly aware of it. A lot of our partners, what we're now looking at is, instead of allowing individual partners to bring in their HIV commodities or their TB commodities or malaria, what we've agreed is that all HIV commodities in the future will be brought in labeled for NACA, so that NACA will clear it. And in the same way, TB and malaria commodities will have that same approach, so that it's now a government-to-government conversation, so to speak, and we can hasten the process of getting those drugs to the people who need them most.
Thank you so much, Doctor, for sharing your thoughts with us on NTA Network News. I've been speaking with Dr. Sani Aliyu, DG, National Agency for the Control of AIDS.